welcome back to The Wellness Effect. If you haven't subscribed to the channel yet, you are missing out. Dr. Dalen Alexander from Bankmed is back in studio to discuss Bankmed's approach to HIV and AIDS. Welcome, Dr. Alexander.
Thank you so much. Thank you for having me.
It's a pleasure to have you. So, Dr. Dalen, how does Bankmed approach HIV and AIDS for its members and clients?
So since Bankmed takes a very proactive approach, we're driven by our wellness strategy. This is our ethos. It runs through our veins at this scheme as well. And therefore, we have developed rich wellness and preventative care benefits where HIV screening is one of those benefits. And the key focus, at least from an HIV proactive management perspective, is driving preventative screening. We have developed several access points, starting with on-site screening at our employer groups, home screening, which we're really proud of, and driving screening at our network, health professionals, and pharmaceutical network providers as well. But we've also, implemented the HIV self-testing kit as well, which is a safe, convenient, confidential test which can, take place in the comfort of your home. All that you need to do is go onto our website, order your kit, and we will deliver it to any address in South Africa. So we really take a proactive approach. We clearly understand that your health is your wealth, and this is the ethos coming from the highest leadership within the organization, from our CEO, and this is what we do on a day-to-day basis. We really want to create a process of early identification through our screening. We want our members to get registered on our chronic illness benefit as soon as possible so they can take the medication. And ideally, we want to reduce hospitalizations, improve quality of life, and increase longevity of life as well. And this is what we do in the HIV space as well.
I love that you work on the prevention. Let's talk about those who are living with HIV and AIDS. What sort of support do you offer your members and clients?
Look, Bankmed's HIV protocols is driven by the South African HIV Clinician Society and the Department of Health. So that's the foundation of how we operate. But we do drive our members to get registered post-diagnosis on our HIV care program. You will have access to 4 general practitioner consultations and a specialist consult within a year per member as well. We also cover HIV-related blood tests like your CD4 count and your viral load, and it's clearly important for us to understand where your immune system is at for better management of the condition as well. We also provide preventative treatment for aspects like mother-to-child transmission, sexual assaults, any trauma, etc. And there's no waiting periods for this process as well. We have quite experienced HIV healthcare team with case managers, which underpins confidentiality in their engagements, medicine adherence, education and awareness, and just closing that knowledge gap from a treatment and education perspective. So quite comprehensive, if you'll ask me.
So Dr. Dalen, we've spoken in previous episodes to specialists in this space, and they've mentioned that the HIV and AIDS epidemic has changed over time. But what data are you seeing from your Bankmed members and clients?
I think from an HIV management perspective, our challenges has evolved. If you look at a decade or 2 ago, screening and prevention was a challenge. In our space, we don't see that issue. We see our numbers from a screening perspective increasing year on year. What we're not seeing is that direct reciprocation in regards to registration onto our HIV care program. Some of our members are getting registered, but not at the rate that we want to. And one of the biggest challenges as well is the medicine adherence aspect as well. So these are the type of things that we're dealing with, that the challenges have evolved into a far more complex process, in a sense where the readiness for change to get registered on an HIV program is a challenge. You need to understand that when you are diagnosed with such a condition, it's a life-changing moment. And it's difficult for the average person or human being to absorb and just go into a care process. So I think a lot more needs to be done in that space, managing those that are diagnosed, and how do we get them onto our managed care programs. And then the next challenge is how do we make them compliant and adherent to medication. And it's not only medication that we're having a challenge with, it's also the pathology, the annual pathology that we require, your CD4 count, your viral load, because this is more or less the indicators of where you are at and how we should manage the condition on an ongoing basis. So these are the type of challenges. The challenges has evolved from preventative screening into now, encouraging our members to get enrolled onto the program, and ideally when they are onto the program, is that adherence factor, that compliance factor from HIV periodic bloods and medicine adherence.
Thank you, Dr. Alexander, for such an engaging conversation, and it was encouraging to note Bankmed's position in relation to supporting its members who have HIV and AIDS.
Thank you, Seth. It was a pleasure.
Thank you for watching. Remember to subscribe. Till next time. Bankmed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by Bankmed, yours in good health.